I want to welcome everyone to the Easing Your Respiratory Concerns After COVID-19 webinar, where we'll be answering the question today, now what? As far as what's to come over the next 40 minutes or so, well, we've got a ton of valuable information and insight planned for you today. And it's going to be presented by Drive's team of respiratory category vice presidents. A little bit of housekeeping before we get into the content. You may have noticed that your microphones are not turned on and that our presentation using Adobe Connect is being delivered over voice over IP or simply audio and video through your internet connection. However, we will be looking to get our audience involved early and often. We'll be using some fun polls. We have a chat pod available. Many of you have already been using that. That'll be available for questions and comments throughout. Please don't hesitate to use that. If you seem to be having any issues in Adobe Connect, please reach out to Sherry Reich. Her email is listed below in the notes pod. We've turned on or turned off the ability to join via the browser and forced everyone to use the app. That's going to give everybody the best experience, at least we hope. So with that, I'll go ahead and introduce myself. My name is Eddie Faber. I'm the National Sales Trainer here at Drive to Vilbus Healthcare. And I've been asked to be the producer on today's webinar. As many of you in this industry know, it has a way of kind of pulling you in and just not letting go, right? Well, it pulled me in about 10 years ago or so. And first on the provider side as a sales rep for a local DME in the Chicagoland area, and then as a sales rep covering the beautiful Rocky Mountain Territory here in Colorado for Drive. And now my responsibilities are to train and support the sales team here at Drive. So enough about me. We know how overwhelming these unfamiliar times can be for everyone, both personally and professionally. And we want all of you to know that we are here to support you in any way we possibly can. We have been busy working from home and brainstorming ways we can help our customers not just survive, but really grow their businesses coming out of this quarantine. That's why we have organized this series of webinars, which is just chock full of insight, best practices, and resources. Allow me to shine some additional light on this Drive Cares program. Now, today's webinar is the latest in the series we're launching today as part of the Drive Cares initiative called Hope Drives Us Forward. The Drive Cares program is committed to putting the latest education, evidence, and concepts in all of your hands so your businesses can thrive both today and tomorrow, helping all of you to do what you do so well, which is maximize outcomes for all of your patients. Today, we're going to be talking about easing your respiratory concerns during what we all hope is the conclusion of this pandemic. Now, I could not be more proud to introduce the two Drive respiratory category vice presidents that will be speaking on this topic today, both of which I've had the pleasure of working with as a sales rep for Drive and in my current training role. So allow me to introduce to you our two speakers today, John Zelchek and Dave Pugh. So John has been a respiratory therapist for 25 years with experience in adult and pediatric critical care, pulmonary rehab, the DME industry, and of course, the manufacturing side. Now, David, on the other hand, has 35 years in sales management and business development in the home healthcare and respiratory manufacturing space. Our objective today for our audience is to determine the most effective strategies for keeping our current and future respiratory patients safe and active while maximizing operational efficiency and productivity during and after the COVID-19 pandemic. So, how are we going to accomplish that objective? Well, we're going to stick to this agenda. We're going to start by looking at some COVID-19 effects on our industry. There's been plenty. We'll move on to some patient, staff, and referral source education. Certainly, clinical and operational strategies are key. So are infection control best practices, and we'll round things out by kind of taking a different perspective, a look at some new opportunities for growth. So with that, I'll hand it to our first speaker, Mr. David Pugh, to talk about some COVID-19 effects on our industry. David?
Thanks, Eddie. John and I want to also add our welcome to this session. We really appreciate you taking time out of your day to join this webinar. I think the first place we'd like to start is just talking about the effects of the virus on product demand, on the patients, and then from a cost standpoint. I want to take advantage of what Eddie said and get you involved early and often, get used to using the chat window. So I'm going to ask you a question before I share what we're seeing as far as growth in this market right now. Please use the chat bar if you would, and let me know how your stationary concentrator is doing. If it's growing and you feel comfortable, share what percentage it's growing by, and then I'll share some information with us. Eddie, I actually see somebody raise their hand again. If there was a question, just type it into the box. See some people typing here. See a couple of folks pop up. Is your stationary oxygen business experiencing a growth?
A couple of people typing there, Dave.
Growth plus.
Matt Walton has some major
Welcome
growth
back,
here.
Matt. Good to hear from you again. So, again, some people aren't typing in, maybe not feel comfortable. Let me share what we're seeing. From January through May 2019 versus January through May 2020, again, June just ended and we're seeing it continue, we've actually seen a doubling worldwide of our stationary oxygen concentrators. So never seen this in my 35 plus years in this business. I've never seen this kind of demand for stationary oxygen equipment. However, we're seeing an equal decline in oxygen portable modalities. So almost an equal amount of drop. Matter of fact, one of the largest direct-to-consumer companies in our space reported Q1 continuing into Q2 direct-to-consumer sales were off and expected that to continue on into the last half of this year. So we think that's indicating shelter in place, reduced travels continuing beyond today. Would also indicate that existing oxygen patients are probably less ambulatory due to the quarantine. So what does this actually mean?
Yeah, Dave, as a therapist, and I know there's definitely some therapists in the audience here, we think that, having that less activity is going to lead to deconditioning of these patients, and that's going to tend to advance their disease progression. In addition, not going to the ER and not getting out to your doctor's appointments. There are a couple of studies out there, like the KNOT study, that clearly shows, activity while using oxygen greatly benefits oxygen patient survival rates. We also know from a more recent Kaiser Permanente study that physical activity is associated with lower rates of hospital readmissions in patients with COPD. This has always and really just been the basis of today's pulmonary rehab.
John, based on that, do you expect we'll see more hospitalizations, readmissions due to this poor health management?
Yeah, I do. I think eventually it's going to cause an effect on these patients who are staying at home and not getting out and not going to their doctor's appointments as well.
So another thing we know about the effects of this on patient is that fear and anxiety probably strike the clinically fragile population more than most. That's equated to less doctor's visits. As a matter of fact, we also know that patients have died due to other issues because of their fear of going to hospitals, doctors, and this is driven strictly by the pandemic. So getting back to normal, reducing trips, contacts with our patients isn't just an economical decision anymore. It's a health decision. We have to find ways to clinically treat the patient, but maintain less contact. So I've heard of this from both sides, depending on which news outlet you watch and everything, whether you think the pandemic is overstated or underplayed, whether you think the precautions are necessary or not. We have to consider that getting back to normal is going to take some time, and that some, if not most of all the precautions that are in place today are part of that new normal. We expect that the fall is going to bring, I wouldn't even say the fall, if you want to call July fall. We're already seeing spikes in corona. We expect the fall we'll see more. And so fully anticipate mass social distancing, personal contacts to be in place at least for the foreseeable future. If for no other reason, this is going to give the patients and people we deal with peace of mind, and also with our referrals. I want to move on now to talk about what the effects have been on the industry. I think if you're on the phone, most people realize that their costs have gone up. We're having to sanitize our equipment differently, our stores, just getting workers back into work. Overall costs have gone up, and you may be wondering when this is going to come back to normal. Trust me, we are too. What's affecting you is affecting us. Global demand for key items like stationary concentrators, regulators, suction machines, pulse oximeters, ventilators. These items have pushed manufacturing beyond their capacity.
Yeah, Dave, there was a recent article in HME News that was interesting about an AA home care survey. This was back on May 15th. I'm wondering if anybody in the audience has actually seen or had the ability to read that article. If you have, please post in chat. Just give us a simple yes if you've seen the article. If you're just joining, we encourage you guys to participate in our chat window. Before I get into the article, it looks like a couple of people have seen it and read it. Andrew definitely read it there. I would imagine many of you guys, if you see HME News, you probably saw the article, but we do have a copy of it in the bottom right-hand corner. You can download it after the presentation if you want. There's a PDF. So, if you haven't seen it, the article was on May 15th. It talks about an AA home care survey that said the pandemic has created major operational, safety, and supply chain challenges. I'm sure many of you are already aware of that. Tom Ryan, the president of AA Home Care, goes on to talk about the survey findings, and it really just drives home the point that the HME sector is subject to a new operating environment and cost structure, as a result of this pandemic, and unfortunately, it's likely to be with us even after this crisis fades.
So don't feel like we're alone. If you watch the news, hospitals have cut budgets and people. They're experiencing just the cost to get PPE in and have enough staff to work the overloads in some of these hotspots has been overwhelming. Food cost, if you're in my area, they're rationing out certain meat items and paper items, and then bottlenecks in transportation. Just getting products to the consumer has been a challenge. I wanted to share with you some of the things that manufacturers are facing right now. This isn't just us. This is everybody. We hear it across the industry. We have shortage of components. This leads to long lead times. Ordering more product is going to take too long to put on the water and get here, so we have to air freight product in. Ramping suppliers has a domino effect. They have suppliers they have to also ramp. So when demand goes up like it has, there's no planning in place to help us with that. We look at our production lines. Remember, we can only run 3 shifts per line, and we maxed that out months ago. So we're adding additional production lines. Until we can get that up to speed, we've been paying overtime, and then we continue to source new suppliers on product. But the challenge there is that we got to vet those out. We have to report all changes to FDA and regulatory, and we want to make sure that the products we're putting in equate to a good finished product for you guys. And the last thing manufacturers are having to make tough decisions on is really just, can we narrow down our focus from several SKUs or models to one model? This keeps us from having to break down assembly lines and restart it up with different products so we can actually put out more items. But these are just a few things that most manufacturers are navigating every day. So we want to talk or revisit. This is going to be a poll question. You guys can check as many of these as you'd like. I'd like to understand from the audience, we have about 34 people now, what makes you feel comfortable as you start to venture back out or as you're dealing with stores and restaurants and people. So we'll reveal the results here in a minute, but we'd like to get just a minute or two of people clicking in.
Yeah, I see. Definitely getting some participation, Dave.
Yep, I'm going to share the results here. It's interesting when you look. There's almost 30 people, mask and gloves and hand sanitizer. Top 2 answers, Alex. That's good.
And it's interesting that they're not, we definitely see that a lot of people aren't really concerned with the higher end PPE and things like that, just using good hand hygiene and just being careful with what you touch and things. So that's not surprising to me, actually, limiting the contact and social distancing. Definitely not surprising.
The 5 people that want no personal contact, you've gotten used to it. I certainly understand that. On the higher end PPE and face shields, we do see that more in long-term care and skilled nursing facilities. As a matter of fact, that's been the slowest group of organizations to allow reps back in, and they'll only do this if you're using some of this higher end PPE. Good. Nice participation. Thanks, everyone. So, no surprise. We expect that everybody on the phone is going to have something that makes you feel comfortable. It's interesting to note that Harvard actually just did a study that said some form of social distancing is going to continue through 2022. So again, we're back to, we have to demonstrate safe business practices, and that's going to create comfort with the patients we deal with. So think about it from your perspective. If I'm comfortable, they're probably comfortable.
Yeah, Dave, there were some recent studies, that even suggested that COVID-19 may or may not be spread by people who are showing symptoms. So it's really difficult to understand. Some of the reports that you get out there vary. And there's currently no vaccine to prevent coronavirus. So, just like kind of the audience said, I think we agree that the best way to prevent that illness is to avoid being exposed to the virus through social distancing and really just good hand hygiene.
Yep.
So over the next several slides, we're still going to get into some clinical and operational strategies in this COVID climate. Feel free to chat, and if you have questions, we'll stop and address your questions. Please, we encourage you guys to participate. We're going to look at patients and providers and see what they'll likely want to do to continue to limit that direct contact now and for the near future. We're going to take a look at oxygen and modality choice, which, we feel like it's extremely more important now more than ever. What are the Dme best practices, moving forward when it comes to infection control and cleaning? And then we'll get into a discussion on what opportunities are on the retail side that may open up due to this pandemic. So as the country starts to open up in general, and patients need to get out eventually to doctor's appointments, visit family, and just get back to life, they're going to need more portable oxygen options. We feel like the whole goal, obviously, is you want to limit those direct patient contacts or touches. We can take some of our high-touch patients down to a reasonable contact. In addition, try to reduce deliveries. And we think it starts with understanding your current patient mix, and there's probably a lot of you guys that are out there doing that already and understand a little bit about that. There are tools that can be utilized. We have some good tools that we can share with you, like our oxygen delivery analyzer tool, our modality selection tool that will help you achieve these goals. You should probably work with suppliers that have a way to, help you maximize the business and maintain that social distancing. If you already haven't, I'm sure you have started to use telehealth to communicate safe practices. There's online options like Microsoft Teams. That's one that we use a lot of. We also use Zoom and FaceTime, get creative even with patients. I talk to a lot of you that are in the audience, and you guys are doing some creative stuff. Mask and other fitting tools, screen and video sharing, product setup videos. Not only are these great ways to assess your customers, they can help you with add-on sales also. We're going to talk a little bit more about that actually later. So we're going to open it up to another interactive poll here. We want to know, what information are you gathering for your current oxygen patient base? You can check all that apply. You don't have to just check one. While you're checking that, we'll wait till some of these results come in. So you have oxygen patients out there. What do you guys have, or what do you gather from those patients, or what are you able to access? Everybody's using different software out there. Probably, I know when I was on the provider side, I used some different software to capture that data. So we'll see a couple of results come in.
John, while we're waiting for some of these results, I'll also tell you that while providers have access to this information, what we see when we go across the country is they don't review this information regularly. We manage exceptions versus having a process to manage our entire patient base. So from what I've seen.
Yeah, David, it's funny. When I was on the provider side, I was on the provider side for 15 plus years, a couple of different providers, and we captured all of this data. And as the results are coming in, it seems like a lot of you do capture all that data. We just didn't utilize it enough. We definitely had meetings about it. We talked about it. We just didn't utilize it enough as we should. And I think now is more important than ever. Really think it just should become a habit. Definitely take a look at this and analyze it.
I've shared the results. Interesting. We've done this survey a couple of times. The smallest one is distance from facility. I think that's an interesting one, being so low, but it's good. One person's looking at that. How far away is that patient? How long is it going to take me to get to them? Especially if you're in an area where you have inclement weather. Typically, we see low kind of measurements on the frequency of time that a patient ambulates. I think that's important, and we're going to explain why here in a little bit. But it looks like you guys have access to this information. We just want to talk about how we better utilize it. Thanks for participating.
Yeah, nice.
Yep. Sorry, John.
Looking at that, Dave. No, I was going to say it's nice to see that people are even looking at the ambulation. I think that's a good way to start to see what device makes sense.
Absolutely. Thank you again.
Yeah, and when you talk about all that information you gather, that gives you a good idea about oxygen modality selection. So, like Eddie says, it's a lot of data to capture. I think it starts with first you have existing equipment that could be used for the right patient. You want to try to utilize the equipment that you have. Make sure your equipment is as compatible with some of the other solutions you have. Look for the best options to limit the delivery or even eliminate them altogether. If you're going out, like one of the person that monitored the distance, you have somebody that's 60 miles away from the office. You want to kind of look and see what option makes sense. You can also move to some remote monitoring. There was an HME News article recently, again in May, that talked about the roles of using IT systems, to help with social distancing and improving care. So be interesting to see if some of you guys are using that. Definitely want to understand your option and really just don't want to try to make it one size fits all option. So take a look and use some different modalities. It starts with examining your existing patient base. You want to reduce that contact and exposure for both your patients and employees. This number, 40%, represents what the average provider still has greater than of their patient base on frequent deliveries. And I even think that's a low number too, based on, traveling across the country. Dave and I both cover, the entire country, and, it depends on who you talk to. Even frequent deliveries or even coming and pick up supplies. I think it starts with simply reevaluating for some type of pulse dose solution.
John, it's interesting. While most patients are considered for a pulse dose unit when they first come into the system, for some reason, many of those users have gravitated back to continuous flow. And I don't know if it's providers not considering alternative pulse dose devices versus the standard pneumatics. But if you really look at the data we see nationally, our national accounts and our regional, large regional players have as high as 80% of their patient base on pulse dose solutions during their entire stay. So it's possible to achieve that.
Yeah, Dave, that's a really great point. I know we have some in the audience. I know we have some providers here that do a really good job with this. It'd be nice to hear from them and what they do, and type it in the chat box if you feel comfortable typing things. But definitely it starts with understanding your patient mix. Understanding these numbers allows you to maximize your profits, limit the exposure to unnecessary deliveries. If you understand the size of the cylinders, the liter flow, the frequency of delivery, you know how much that individual is ambulating in a given period of time. Not only are these deliveries costing you money, they're exposing your patients and your employees to more touches and more, getting more exposure out there. So, you've already seen costs going up due to increased safety protocols, right? PPE and other measures. It seems like, based on the article and based on what's going on in the world, this is going to be necessary for the foreseeable future.
So look, I want to give you an example. This is a live person, Gary. that we did some studies on, and there, as John will tell you, there's a lot of Garys in the clinical world. But it starts, like John said, there are a lot of tools that can help you best decide the right deployment of equipment. But you do have to understand the data that's typically available in either your billing or intake software. So Gary, in this instance, just sharing with you what we saw here. Eddie, I'm having trouble getting my arrow to click. Can you help me with that? Thank you. So Gary was at 2 liters. We know that we delivered e-tanks and that we set him up. This is why it's important to understand what the actual portable modality is that you set on the patient. Was on a regulator. We now know that that e-tank at 2 liters is going to last about 5.4 hours. And from our intake software, we recognize that we delivered 20 of those cylinders, and it took us 2 trips to get those to the home. This is why we said it's important to do that math, because now I understand what the ambulation time is on a monthly basis and on a daily basis. And simply by making a quick reevaluation of Gary's portable needs, we were able to get him on a conserver. Now that tank goes to 24 hours. It only took 5 tanks to equate to the same ambulation time, and we were able to deliver those 5 tanks once. We're not jeopardizing his ambulation. We're giving him the same amount, but we've created less deliveries and less tank touches for you. Economics makes sense, but for the patient, it's fewer tanks to manipulate and to deal with, and less contact with outside sources. So they're happier and healthier because of this.
So, Dave, I had a lot of Garys in my company when I was there. I would venture to say that, everybody on this call has a few Garys in their system for sure.
Yeah,
Eddie has a few Garys too.
This is more common, folks, than you might realize. This is the other reason that John and I both really stress understanding doing this on a regular basis. If you understand this ambulation time, if you start seeing your daily ambulation rates going up 10, 12, 14 hours a day, that's a lot for most COPD patients. It's not impossible, but there is a diminishing return. All that costs you is a re-education. They may be using their portable in the home rather than their stationary equipment as prescribed. So you just need to understand that. A couple other comments that I'll make is it's easy to decide this once the patient, this is why you should look at your existing base now to determine this. But I have a lot of providers that will tell me, I don't know how much somebody's going to ambulate when they first come into my system. So I would tell you that's true, but within 14 to 30 days, you're going to have a better idea how much they're ambulating by looking at simple information like this, and you'll be able to make a better selection. The biggest thing, and John's already stated this, is don't make one size fit all. It's not possible. And don't make a decision on, putting an expensive product on the patient if they're not ambulating, because you'll trade the deliveries for acquisition cost.
Yeah, Dave, I think it's really the key is just making this part of your routine and re-examining this and, taking a look at these numbers. I think it's valuable. I'm going to open up a question to the audience again, and, please feel free to type a yes in the chat window. Do you feel like there's room for improvement in the way you manage this data in your business? Give us a yes if you feel like, you guys can do better, or if you have some Garys in your system. Please feel free to type. This is a no judgment free zone, like Eddie said. Dwayne, yes, I know Dwayne says he has some patients in his, as Jan does as well, and Michelle. I would venture to guess almost everybody on the call does.
They say the first step to recovery is admitting we have a problem. So that's yeah. You're not alone. If you think you're looking at this information on a regular basis, you'd be surprised how often patients slip through the cracks once they're in our system. So yes, everybody.
I think we did a good job at it, and then when you really examine it, you really, you can always do better. Rick has a question there. I just saw it pop up in the chat window. It's a good question. It's actually going to be a good segue to what we got coming up later on. But does anyone out there put a pulse ox on their patient when they put the patient out? Does anyone? Now, I assume he means have a therapist go out there. Rick, do you mean have a therapist check, or give them a pulse ox, or sell them a pulse ox? Clarify if you want to clarify that. I see a couple of people are typing.
While they're typing in, Rick, I will tell you that a lot of pulse ox is one of those items that has gone crazy. I've never seen them like this, but I will tell you a personal story. My sister-in-law was diagnosed with COVID. Her SATs weren't bad enough to admit her to the hospital, so they sent her home and they said, you're going to need these items, and one of them was a pulse ox. So whether anyone's putting it out or not, we are seeing those get deployed at a much more rapid rate.
Yeah, more than ever. Wait, a couple people are typing there, and definitely, I would imagine a few of you guys have seen the same thing Rick has seen for sure.
So it looks like we have some walk tests going on. Thank you, Melody, for that.
Yeah, Dwayne has all of his RTs evaluate patients. We see that a lot. I'm a therapist by background. We evaluated every patient. That was our goal, to evaluate every patient out there.
I think that the concern is that people say that that takes time and therapists, and I would tell you that it's worth it to make a better upfront decision, spend a little more time to decide that. So I like the idea of having somebody evaluate the patient. The other thing is there are a lot of options. So don't just evaluate them for one and then move on to continuous flow. Keep your options open. But if you don't have a therapist involved, that could create a problem. Yeah,
that's what Jan mentions, that anybody that's issued a conserver, they document their SATs and walk them. Dwayne brings up a really good point. It's been harder with COVID. How do you manage that type of situation? I mean, obviously, people aren't comfortable with that, face-to-face, high touch. So certainly there's probably things you can do. You can mask up, or you could, certainly like Rick was saying, maybe you sell them a pulse ox and do it remotely. Does anybody else have any answers or solutions to Dwayne's question there? Does anybody else do anything differently? Yep, Dawn, I'm sure. Yep. Dawn's a therapist, it seems like, right? She's looking for signs of hypoxia. Yep. And she said,
Dwayne, providing the pulse ox that we talked about, and then having some online tool to actually contact the patient is a you should have both options. But during that, you can walk them through how to use the pulse ox, how to evaluate themselves. Might be a solution short term.
Yep. I know Dwayne is a therapist too. Worked with Dwayne many times, so it's a good idea. Let's go ahead and move on to the next slide. We'll take a look at it. So we're going to talk a little bit now about some DME best practices, and please continue to ask questions and participate in the chat polls. It's great. We want this webinar to be informative for you guys, and if you have questions, we can certainly get some best practices from the group. I mean, we got 35 people here that are probably doing this every day. When we talk about cleaning versus disinfection, we're going to get into that. So when you think about cleaning, that actually refers to the removal of germs and dirt and impurities from the surfaces. It really doesn't kill germs, but by removing them, it's like washing your hands, it lowers their number and the risk of spreading infection. Disinfection refers to using chemicals, for example, EPA-registered disinfectants to kill germs on surfaces. By killing the germs on the surface after cleaning, it actually further lowers that risk of spreading infection when you're cleaning your equipment.
John, before we move on, I want to offer just a quick word of advice. Yeah. When you're picking this disinfectant, check it with the manufacturer's guidelines, because, again, no matter what your accreditation manual says or what a manufacturer's cleaning guidelines say, if you pick a solution that requires you to saturate a unit and let it set, you have to follow those instructions. A couple of things that I've seen is we know that some of those chemicals have harmful effects to the plastics of the units. They also leave behind a residue that can affect the patient as well. So be careful when you're picking that and follow manufacturer's guidelines.
Yeah, Dave, that's a great point. Manufacturers should actually provide tech bulletins on cleaning like the one shown here. This is the one that we provide our customers. So definitely reach out to your manufacturers. You obviously should have your staff wear PPE, take universal precautions, wear masks, gloves, definitely hand washing. It sounds like you're all doing that from the earlier poll. When servicing the equipment too, for redeployment. Some of the other DME best practices, changing intake filters between patients. It's strongly advised, and make sure you're using qualified replacement HEPA filters. Some of the HEPA filters, well, all of the HEPA filters have filtration efficiencies. You should know your filtration efficiency. This is an example of our HEPA filter at 99.97% for particles of 0.3 microns. So it's really important to know what type of filtration your current products use, and know the HEPA rating to determine how efficient that filter is, as well as utilize what the manufacturer's guidelines are, between patients. So up until now, we've discussed limiting contact. It looks like we have a question there, but I was going to say we can open up this poll, but we'll address the question
John.
in a second. I was going to say, go ahead, Dave.
While they're filling this out, I just noticed that Carrie asked, is anyone having trouble getting concentrator filters, vent bacteria filters? I can't speak to the ventilator filters, Carrie, on the concentrators. Yeah, that's one of those supply chain issues that we spoke about earlier. Our intake filter is a HEPA filter. The company late last year, mid last year that we get them from actually moved their facility, and they've been ramping up. And so when this hit, getting additional filters has really put a crunch on it. We are able to, I can tell you, this came up on another session we were doing, and we were able to check. We do have plenty of the intake bacteria filters for both 5s and 10s, but I'm seeing them being changed out at a much more frequent basis. So I can't speak to that long term. John, anything to add there?
Yeah, I think you're definitely not alone, and I think it goes with all products, Dave, not just concentrators, ventilators, nebulizers. People were being very over precautious, and in some cases, rightfully so, for sure, and changing out the filters. I would think that manufacturers and suppliers are ramping up production. I know ours are. We get most of our filters from suppliers. We don't make our own filters sometimes, depending on what it is. But that's been a tough thing. It's kind of like pulse oxes and concentrators and things like that. So, but definitely we've seen that, and you're not alone for sure.
Gary,
wait
a minute, John, hold on. Carrie, be careful when you're also looking at that. I've seen people try to make 5-liter filters fit 10-liter units. The airflow is different. Yeah. I've seen people trying to bring in, remember there's certain masks that have a much better filtration quality, and there's certain filters that'll have better filtration qualities. Just make sure you're picking one that allows the proper airflow and allows the right filtration properties.
Yeah, I think just check with your manufacturers. So back to the poll. Looks like a lot of people are starting to put answers in the poll. I think communication is even more important now than ever. We up until now we discussed limiting contact, but what we would still suggest is you need to maximize those contacts when you're out there with your patients, or when your patients contact you. So the question is, how do you make end users aware of the other items that you carry that may be needed? And it looks like a lot of people are chiming in on some different things here. I don't know if you broadcast the results yet, Dave, or you want to
I did broadcast them. I will say that it's interesting, a good mix here. I'll let John talk about some of these, but I will tell you that in our experience, we see companies that are good at one, maybe two, not exceptional at multiple medians to not only, like John said, this is now about maximizing your exposure and your touch without actually touching the patient, but find ways to increase your business. So John, you see anything in the results I'm showing here?
No, it's interesting. Retail front is still the number one, especially with, people being concerned about getting out and getting into the store. I think, that's great. If you can get them into your store and kind of, we'll talk about it here on the next couple of slides, but websites, social media, definitely underutilized. I mean, if you think about it, even though you have older patients that you service or older clients that you service, a lot of the caregivers are, at an age where they're on social media. So I think it's underutilized, social media. Delivery technician is a huge one. I mean, they're right out there in front of your patients, and I'm sure you guys that utilize your delivery tech, you can definitely see some good sales with that as well.
I like the mixture here, John. It looks like everybody's trying to use a little bit of something to at least communicate and touch the patient.
Yep, agreed. Thanks for your participation.
Thanks for participating.
Great. Yep. So, with all these retail mediums that providers, are using, you definitely should be able to increase that opportunity in that space. And that's the one thing that this unfortunate pandemic has caused us to look at things in different ways. And, there's some creative ways to open up revenue streams and do education. Have you thought about the best way to use social media? Zoom, GoToMeeting, Microsoft Teams, FaceTime, definitely something that can help you interact and show product, get creative with it. Having videos set up and support materials to give your patients alternative ways of connecting. Get out the old school email. I know that we didn't have a lot of people type an email. Seems like it's way in the past. But certainly try email. People are home more often. They're on their computers now. They're looking at their emails probably. Just understanding the best ways to reach them now, I think, is more important than ever. If you're scheduling those in-person appointments, stagger the appointments and bring them into your showrooms. It sounds like a lot of people were doing that based on our poll responses. Eddie asked a question in the chat window: is anybody using these with their patients and customers? While you guys are typing, or if anybody has any comments there, some providers take advantage of our Tech to Teach program. If you haven't, definitely we'll show you how to reach out to your local territory business manager. Really good Tech to Teach program that shows people, what they may want once they get the items they need. While in the home, consider things your patients normally pick up from you. Can you deliver while you're going there for another reason? Here's just a few examples of retail and respiratory items that providers have seen success with. So, if you look at some of these items, you may be saying, yeah, we definitely have seen some success with those items. If you're looking at those items on the screen there, I know Eddie asked for a question there. I got another question for you guys. Are there any items that you would be willing to share with the group that you've had luck that maybe we didn't list here selling? Please use the chat window if there's anything that you've seen fly off the shelves. I could think of a couple off the top of my head. But just curious if anybody is willing to share with some of the other participants here. We have the audience. Yep, locker baskets. That's definitely one for sure. Rick, has shared that. Think about it. Patients are at home, and they're ambulating around. Bath safety, fall mats. Dave, definitely.
Rick,
think about all the things you do in the home.
Rick, I don't know if you were on our retail presentation, but walker baskets is one of those items that we've seen really go up. And I can't explain it, but our retail folks can. Dwayne, we've seen this, the So Cleans, the way to keep the CPAP stuff, the lumens. Yes, absolutely. Those are great ones.
Man, I wish I bought stock on that stuff a long time ago, huh?
Yeah.
Looks like Hannah, or Melody, Hannah has a question about touchless thermometers. If anybody has any insight how to get those that people can afford, please feel free to type in the chat window. Definitely thermometers are a big one for sure. So yeah, a lot of stuff coming in. And that was the next question I was going to ask. I was going to say, does anybody have trouble getting items or getting staff to sell items? Do you have trouble getting your delivery techs or your staff to sell additional items? We call it up carrying. Does anybody have trouble with that? Feel free to post in the chat window if you're having trouble. Yep. Yeah, for sure. Everybody's doing thermometers for sure. Anybody? It seems like it's a lot of stuff going through the chat window, but we see occasionally patients, providers, having trouble. Sometimes, when I was on the provider side, we had that delivery tech that was awesome. He really, upsold it, and to the patient, up cared, and wasn't overselling them. It was showing them some things, but then there were always that person that just didn't want to be a bother to the patients, and really, in reality, is it's not a bother most of the time. It's helping them, so they don't have to get out, especially in this COVID climate. Think about it. They don't want to get out. They don't want to have to drive to Walmart. So,
John, couple of things on the thermometers, guys. Just so you know, we've not with thermometers, but I've experienced this on the pulse ox side. the screens, the LCDs and the different types of screens people use, the electronics companies that provide those are having a shortage. That's probably driving up some of the shortages in thermometers on the touchless ones especially. So that's one of those supply chain issues that you're probably dealing with.
Right.
John asked a good question, and I know there was a lot of chat going on about this, about getting staff to actually spend time. You know, I hear a lot of times delivery techs aren't salesmen. They don't want to be salesmen. Still see more conversation about the touchless thermometers.
Yes.
But here's the thing. Here's the thing with your technicians. They need to understand that we're up caring for these patients. There are items they will need after they get what they want. That's what John was explaining. So just, you know, make sure that they change their mindset to be thinking in terms of, I'm not trying to sell the patient something they don't need. I'm trying to up care them to what they'll eventually need. And we need to maximize that communication and that touch while we're with the patient. Just something to keep in mind.
Yeah, very good.
Good. I
All right,
love
Dave.
the fact you guys are sharing best practices and places to go to. That's really good.
For sure. Yep, and I see that all over the country too. So, you know, on that note, you know, Drive to Vilbus, we have you covered. You know, we have your back if you have questions, even all the way down in the Bahamas almost, right? You see that? We're in Florida there.
We do now.
On the map.
I'm going there.
I'll volunteer, Dave. I'm closer. No, I'm not closer. Actually, you are. So this map actually shows the location of our national sales support team, you know, which includes local territory business managers, you know, in Canada as well. You know, I don't know if we have all of the points in Canada covered, but we definitely covered, you know, all the points in Canada as well. You know, we actually have boots on the ground in those areas, regional sales directors, regional vice presidents, and clinical vice presidents like Dave and myself. Dave and myself cover the entire country, you know, virtually and in person at some point, hopefully back here soon again. You know, these are all Drive resources that are available for you for teaching, for coaching both your staff and your referrals. We're available for webinars, so please, you know, feel free to reach out. You know, our sales team is really good at helping identify key retail items. I know that I've spoken to a few of you on the call. That's something you really want to grow, your retail side. You know, we just actually finished a retail training like this one. You know, if you're interested in any of our presentations, they'll be posted on our website here shortly. You know, and reach out and take a look, and you can actually see, get a copy or listen to that presentation or those other presentations. We have a pressure prevention one too as well, if you hadn't joined earlier and seen those. You know, we really want to thank you today for all your participation. You guys have been great. Thank you very much. You know, if there's any tools or help we can provide to you, you know, please don't hesitate to contact Dave or myself, you know, on behalf of Dave and myself and Eddie. You know, you guys have all been great. We really appreciate it. And I'll just turn it over to Eddie to take us through the recap.
You got it. Excellent job, John and David. And to our audience as well, love seeing all the banter. Like I said in the chat pod there, we're all in this together. And it's a great environment when we can not only learn from our speakers, but from each other as well. So we just heard a ton of great information surrounding your respiratory business coming out of this pandemic. And hopefully we have eased some of those respiratory concerns. One way we discussed that could help to do exactly that was to implement education, operational, and clinical efficiencies. Now may be the best time to reevaluate your business with limited contact being on pretty much everybody's mind. How about properly incorporating those infection control best practices, and how critical both demonstrating and communicating these practices are to your patients, customers, and referral sources so that your business is branded the way that it deserves to be. And finally, how taking a hard look at how your business offers goods and services to your patients can not only uncover some new growth opportunities, but also change the way that your customers perceive the way that you run your business. Now, David and John have what we call an open door or open phone policy, I guess now. These guys are looking forward to hearing from you. I wanted to share their contact information directly with our audience there for both John and David. They're eager to help. They want to hear your feedback on the thoughts discussed in this webinar, so please don't hesitate to reach out if you want to jot down those contact information for John and Dave. They are on the screen now. So with that, guys, I want to thank our audience for being super interactive, engaged, supporting us by attending today. We certainly want to do more of these, and we want to continue bringing value, bringing us together, learning from each other, learning from our speakers. But we can really only do that if we hear feedback from you. So when I conclude this webinar, you're going to be automatically taken to a very brief SurveyMonkey survey to do exactly that. Just answer some questions, provide some feedback so we can continue maximizing the value of these webinars in the future. One final note, there will be a link to this recording of this webinar sent to everybody after this session. So expect that is going to be on the way. With that, this is Eddie Faber. One last thank you to everybody. For Dave and John, I'm going to end the meeting now and take you directly to that SurveyMonkey
Hey, Eddie.
Survey. Yep, Dave?
Before you click off, it says, I have a question on POCs. How does anyone afford to provide a POC? You know what, Melody, rather than, I'm happy to talk to you about that. I know that Josh is typing. I think it really does come down to, well, private pay is an option, but there are some people that are saying, based on that ambulation time, that modality may be the best selection in some nursing homes and in some rental places. That is a good option. But let's do this. If you'd like, we shared our email. If you didn't capture that, Melanie, we're going to have a list of these questions, and either John or myself will reach back out to you and we'll discuss it.
Yeah, please reach out. I mean, on the provider side, I totally understand where that question's coming from. You know, we see it every day. You know, there's certain customers that are able to do it based on what Dave said, distance from the facility, what makes sense the most. We'll reach out to you too as well. But, you know, like Josh said, there's always the private pay, you know, retail side too as well. So it just depends on, you know, what you're looking at. Some of those patients cost you a ton of money. It might be worth putting a non-delivery item out there.
Yeah, and if you have that patient that is ambulating, you know, they're maybe adult daycare, they're still in the workforce, they're still out every day. You know, that may be a better solution to regenerate their own oxygen through a POC, but you got to be selective about it. But Melody, I got your email, and we will print this out, and one of us will get in touch with you. But we thank everyone for joining today.
Thank you very
it.
much.
Thanks, everybody.
Thanks,
Take care and have a great day.